Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a fascinating show you won't want to miss. We're talking about sports medicine and sports-related injuries, common causes, risk factors, how they're related, and steps you can take to decrease your odds of getting injured. We'll discuss physical therapy as well as surgical options. Be joined by a panel of the leading health professionals in this field. Hear patient stories of success and take questions from our live studio audience. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at sports medicine with the team at St. Luke's. Stay tuned. Thanks for being here. Let's get started. We have a great panel of guests joining us. Meet Dr. Nick Avallone. He serves as the Medical Director of Sports Medicine at the St. Luke's Warren campus. Dr. Avallone is a graduate of Princeton University and Robert Wood Johnson Medical School. Additionally, he's a fellowship-trained orthopedic sports medicine doc and board certified in both orthopedic surgery and orthopedic sports medicine.
My interest in sports medicine started in my earlier years. I saw people were able to get folks who were injured and get them back out in the field. I thought that was the most magical experience. I practice orthopedic surgery at St. Luke's. We have folks who have been injured and they'll come and give me a picture of themselves and they'll sign it, doing the things that they want to do again. So that really is the best part. St. Luke's provides a very comprehensive, high quality health care, but also it makes you feel more like an individual rather than a number. It really helps to have folks who are on the scene that are really on your team.
Welcome, Dr. Avallone. Thank you for being here.
Thanks, Ashley. It's great to be here.
Well, you know, St. Luke's is the region's largest provider of sports medicine care. Over 100,000 people in New Jersey and Pennsylvania. Those are huge numbers. It's amazing.
It sure is. You know, we've really grown quite a bit, and we're very excited to be able to take care of lots of folks in New Jersey at this point.
What are some of the most common injuries that you see?
Well, most of them are strains and sprains. You know, a lot of folks getting out there and, weekend warriors, as you might know, and it's just, getting out to just trying to be active. Certainly a lot of keeping good health is about being active, and just being able to go and run and do some things that you like to do, that's a great thing in life. But unfortunately, some folks end up getting hurt while doing that. Ankle sprains, knee sprains, a lot of people end up having some shoulder injuries. So really the common things are just sprains and strains.
Great. Thank you so much for being here, Dr. Avallone.
My pleasure.
Joining our panel next is Dr. Brett Keller. Dr. Keller is a fellowship-trained primary care sports medicine physician who earned his medical degree from the Philadelphia College of Osteopathic Medicine. He was the team physician for the New York Jets, Drew University, and Seton Hall University, just to name a few. Dr. Keller cares for athletes and non-athletes with acute and overuse injuries.
The most rewarding part of my job is getting that athlete back on the field or getting that person back to what they love to do. It's such a rewarding thing for them to say, thank you for getting me back to where we are. So one of my roles is a concussion specialist. In fact, I'm the only concussion specialist in this region in Western New Jersey. A lot of times a patient will have a head injury. They usually get the patient in to see me and evaluated pretty quickly. Here at St. Luke's, we have an amazing team of sports medicine. I would recommend St. Luke's to everybody. We have a comprehensive team, and we're able to recognize and get you pointed in the right direction quickly.
Welcome, Dr. Keller. Thank you for being here.
Thank you for having me.
So tell me, what is a primary care sports medicine physician, and how is that different from what Dr. Avallone does?
So a primary care sports medicine physician is pretty much a non-operative orthopedic surgeon. we see the same type of patients. We will see a lot of the same patients with acute injuries, overuse injuries, but it's a little bit different path to get to that position. So from my path, usually a primary care sports physician is trained in primary care before they ever get to the world of orthopedics. I did my training in family medicine. You can become a primary care sports medicine physician from an emergency or a pediatric pathway, but then you do an extra year of sports-centered training called a fellowship. And for my fellowship experience, I was able to specialize in a lot of things that are localized for orthopedic surgery, concussion management, sideline coverage, and ultrasound technology.
And really important for patients to know that that service exists. So thank you so much for being here.
You're welcome. Thanks for having me.
All right, let's meet our final panelist, Seth Eisenberg. Seth graduated from the University of Michigan with a degree in athletic training and a doctorate in physical therapy from the University of Pittsburgh. Seth is a board-certified clinical specialist in sports physical therapy and specializes in the treatment of athletes and active individuals of all ages.
At St. Luke's, I am a regional director with physical therapy at St. Luke's. I love what I do. I love treating patients. I love getting student athletes back on the field. One of my personal goals is really to make sure that all these student athletes are staying physically fit and physically active. So we try to make that experience fun for them. The thing that makes us unique is our board certifications. We actually have 40+ board certified physical therapists, which is the most in this region by far. Getting those board certifications helps improve our long-term outcomes for our patients.
Seth, thank you so much for being here.
Thank you for having me.
So as a physical therapist, tell me about your role within the group and within the network and how you provide the best patient care possible while also working with primary care and orthopedics.
As a physical therapist within the network, we are in a very unique spot. I see patients who are referred to be non-operatively from someone like Dr. Keller. And sometimes I will see patients post-operatively who are referred by Dr. Avalon. And there are times where we're actually frontline providers, where we will see patients direct access, so they self-referred themselves to physical therapy, and we will treat them, and if needed, we may end up referring them to someone like a Dr. Keller or a Dr. Avalon.
It's interesting because you can see patients, like you mentioned, at all different stages of their journey. Maybe they've just come out of primary care, maybe they just walked in because something was tweaked, and maybe they're post-operative. So all those chances.
It really keeps us on our toes. You know, every day is a little bit different, and that makes our days fun.
Thank you all so much for giving us a better understanding of your individual roles and how you work together. Coming up, we'll dig deeper into how the panel works together to solve the complex medical issues and how sports-related injuries don't just affect the kid on the playing field. We'll also hear from patients and our audience later in the show. Stay tuned, we'll be back after a short break. You're watching St. Luke's Health Now.
During my freshman year, I played football, and we were doing a tackling drill. And as soon as I tackled him, I dislocated my shoulder, and in the process, I tore my labrum. I knew something was wrong right away. I went to St. Luke's Care Now, and then they referred me to Dr. Avalon for surgery. I would recommend St. Luke's for someone with an injury because they're fast, effective, and they took very good care of me. Currently, I feel great, almost like nothing ever happened. St. Luke's made me feel confident to come back into my sport. They're very friendly, they're very welcoming, and you know you're going to be better quick.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our audience for being here today and providing us with questions, which we'll get to later in the show. Joining me is a compelling panel of medical professionals, Dr. Nick Avalon, Dr. Brett Keller, and physical therapist Seth Eisenberg. We've discussed their individual roles and approach to sports-related injuries. Now let's get a better understanding of some of the treatment options available at St. Luke's University Health Network. Dr. Avalon, we're going to start with you. According to the CDC, recreational and sports-related activities account for an estimated 3.2 million visits to the emergency room, mostly in kids. This seemed like an astounding number to me.
It unfortunately is. A lot of it's just recreational type play, to be quite honest. So trying to teach your kids safety in how they're playing, that's probably number one. But insofar as sports are concerned, certainly having the proper equipment, that's very important. And to be honest, just making sure that they're doing things with the correct technique and form. In fact, we actually have an ACL injury prevention program that we've started at St. Luke's, and that's been very successful at helping local high school athletes be able to hopefully stave off a problem that can be a pretty difficult one, very challenging.
Dr. Keller, how about you? You see a variety of injuries. So what's your approach when you see a patient, you're not quite sure, how do you assess their injury and what do you do next?
The first thing I do when I assess a patient from an injury is basically just talk to them about what happened. That's the first thing any good physician does, is we sit down and we just say, tell me what's hurting you, tell me what's happening. A lot of times you can kind of narrow down a couple different possibilities of an injury just from hearing what happened. Was it a fall? Was it something that you're just overusing or doing at work, or that kind of thing? And then it kind of goes through an examination. We kind of talk about a different couple things in the office and localize, all right, where do you think the pain's coming from? From a primary care standpoint, my job is to try to figure out where it might be, what might be the issue. Is it something that is a little bit more involved and may require something like a cast or a procedure like a surgery, and really correctly identifying what that might be and where it needs to go.
It's amazing how important the story and the scenario surrounding an injury is to the diagnosis.
Very much so.
Seth, what about you with rehab? You're talking about physical therapy and rehab. Why is that so critical to sports medicine across the board for a variety of injuries?
So if you have someone who has surgery, let's say they have ACL surgery, Dr. Avalon will do a great job of repairing that ACL and putting a great graft in there. But then we have to kind of start at square one. That patient probably will come into us and they won't have very good motion. They won't really want to bend their knee. So the first thing we have to do is get them to bend that knee a little bit more. And then your body has a lot of protective mechanisms. Mm-hmm. That number one protective mechanism after any sort of knee trauma is for the quad to actually shut down. So the muscle in the front of your leg just doesn't want to work anymore. So we have to get that to turn back on. And the analogy I use is it's like jump starting a car. Mm-hmm. We stick some electrodes on it and wake it up and really progress from there. So we're working on their motion, we're working on their strength, and 3 months down the line, 4 months down the line, we're working on functional activities. We're getting them back to jumping, hopping. You don't go from surgery and being on crutches to being able to run in a flip of a switch. You really have to build up the steps and build the foundation of the house.
And Seth, what I hear you saying also is that this communication is really important between the various groups. So Dr. Avalon, tell me about how all of you work together and come up with a plan, and how individualized is that plan for each patient?
Every patient's different, and we really take that to heart at St. Luke's. And so what's the nice thing about just the setup just between the three of us, even though there's really a much larger team that's involved, is that the communication is really key. So I'm able to freely speak with Brett as well as Seth about any patient that we're going to share. So Brett likely sees the patient first and works them up. And if there's something that's surgical or needs a different level of care, he'll come and grab me. But at the same time, we're working with Seth during that process. Brett's probably already started with some physical therapy of the patient, and if I do operate on the patient, then sure, they sure are going to go through some therapy afterwards.
It's really, really good to know. And Dr. Keller, when you see these patients and they come in, what's the advice that you give them about sort of preventative medicine and sports-related injuries? What role do parents play? What role do coaches play? A lot of these injuries, we're talking about children, so their parents are there. Tell me about the role the parents and the coaches can play in preventative sports medicine.
I think one of the best things that parents and coaches can do is talk to your kids, all right? Talk to them and find out, are you in pain after practice? How do you feel after that game? Is something bothering you? Because not every injury is we're picking somebody up off the field and carrying them off. A lot of times it's, I saw you limping out there. Are you having some pain in your knee or your foot? And really just kind of getting an idea of what may be bothering them. I teach parents and athletes, as well as the Weekend Warrior group, to just listen to their body. If something is kind of crying out to you that it's hurting, maybe there's something going on, brewing, that may need some attention from us.
It's important really to listen to those messages and know that maybe a kid isn't just complaining. There really might be something going on. Seth, what about misconceptions and preventing injuries? I know there's been a lot of advances in this field. Are there any misconceptions that you hear from people about their physical health that you sort of want to bust for us here today about sports-related injuries?
A lot of times we will hear things that you should push through the pain and that you should really, don't worry about the pain, just keep going. And that pain response, that your body telling you that there's pain, that's there for a reason. There's something wrong that we need to address. Now, hopefully it's just a tiny little thing that, with a couple stretches that we can address, but it could be something that has a cascade of events. Our biggest concern is that you ignore that pain and then you compensate and your body's all connected. We talk about it being a kinetic chain. You're going to cause other issues somewhere else in the kinetic chain that's really going to throw things off and could potentially have longer consequences.
Really good point and excellent information, because ignoring that pain can snowball into something so much worse. All right, we're not done yet. After the break, we'll learn more about the role of technology and communication in the healing process. You're watching St. Luke's Health Now. Stay tuned.
My name is Nshira Quay. I am in 12th grade and I go to Phillipsburg High School. I play basketball. During one of my games, I was going up for a layup and then one of the girls hit my head. But then at halftime, I felt slowed down and I was having this huge headache. I wanted to keep playing, but I knew something was wrong. They did an eye test to check if I had a concussion. My whole experience was very calm. Everyone there was nice. They made me feel comfortable about going there. Knowing that I have St. Luke's makes me feel safe. If I know if I get hurt, I can come here and they'll take good care of me to get better.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a really interesting show tonight. We're talking about sports medicine and sports-related injuries. They affect a lot of us, and the variety of injuries and treatments is vast. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Nick Avallone, Dr. Brett Keller, and Seth Eisenberg, a physical therapist. Thank you all for being here. In the first part of the show, we talked about some of the most common sports-related injuries. We talked about patient care options, the role each of you play in the healing process. But technology and communication and advancements really are a big deal right now. So let's get into that. Dr. Avallone, a lot has happened in the surgical realm, and it is not your grandfather's knee replacement anymore, I guess is maybe the way to put it. Tell me, when is surgery the only option, and is that ever the case?
Be honest, for the most part, if you break your hip or you have a forearm fracture, you break your tibia, yeah, I guess you don't have much of a choice. That being said, we try to give patients options. And so let's say you're unfortunate enough to tear your rotator cuff in your shoulder. All right, well, we usually start with physical therapy for that. And you don't have to necessarily get surgery for a lot of these tears. But if it comes down to it, then sure. And there's minimally invasive arthroscopic techniques that we utilize with little cameras and small poke hole incisions that helps to get patients back relatively quickly.
Yeah, and you are getting patients back faster and faster. So Dr. Keller, explain to me a little bit about the role of the athletic trainers, because they're the people reporting to you before, during, and after, and often working with your patients once they've had a surgery. So tell me about the role they play.
The athletic trainers in St. Luke's and at outside schools play a tremendous role in the care of athletes. One of the best things that I use athletic trainers for is for them to kind of be an extension of us. They are the front lines of care for athletes right on the field at their schools for games and practices. They're kind of be the first lines where the athlete will say, you know what, this hurts or something might be wrong. And it's their training and their expertise in examination techniques that kind of alert us, maybe something's wrong, maybe you should go see Dr. Avallone, Dr. Keller, to kind of see what may be going on. And then conversely, when we get them back on the field or back to practice, they're again the front lines making sure that the athlete is doing well and not having any setbacks to be able to continue to do that.
So there's a level of communication and trust that happens with the athletic trainers. I would imagine that not only helps with your job, but also helps with the coaches and the parents through this process as well.
Very much so.
Well, Seth, if somebody has not been to a physical therapy office lately, they may not know that technology is playing a huge role in physical therapy, because there are all kinds of cool contraptions and devices and things that are aiding in the work that you do. Tell us a little bit more about that.
Well, one of the most unique pieces of equipment that we have kind of throughout all of our Lehigh Valley and New Jersey clinics is something that we call the Alter G, where you put someone in, you zip them into this little bubble, they're wearing some compression shorts, and you can de-weight them up to 90% of their body weight. So if I had any sort of lower body injury, such as an ACL injury, I can start walking and even progress that to running, but I'll never develop a bad gait pattern. So I'll never have that limp. So then we're never developing those bad habits, so then we can get back to a lot of our activities in a more normalized pattern much quicker.
It really is cool to see all the things that you can do to help patients. And Dr. Avalon, you mentioned a little bit some of the less invasive, I guess, surgical techniques. How is technology helping you on the surgical side, and what kinds of results are patients seeing now that they didn't even see 5 or 10 years ago?
It is quite amazing. I must tell you, from residency, when I was doing my residency up at Harvard, we thought we were doing some cutting edge stuff. Well, that's 15 years ago now, and so now here we are doing things that are even more minimally invasive, utilizing the camera, the arthroscope, even my partner, utilizing some of the robotic types of technology that we have now for different types of joint replacement type surgeries. It's really quite amazing at how you can get people back walking day of, say, a knee replacement surgery, hip replacement surgery, things that were just unheard of even 10 or 15 years ago. So we think we're really excited about those types of opportunities.
And ultimately, getting patients back to their lives is really what you're all working towards. So thank you all so much. We are not done yet. We will be back. Up next, questions from our live studio audience. Stick with us. You're watching St. Luke's Health Now.
I was at an indoor stadium and I planted my foot and tried to turn back. I knew there was something wrong right away because as soon as I tried to run back in, my leg just dragged behind me and I had no strength in it. I had an ACL repair with a hamstring graft and my meniscus screwed down. So I went to Seth and he really held the reins in on me but pushed me while I was at physical therapy. When I go to college, I plan on becoming a physical therapist because this crew at St. Luke's just made me want to do that. The way they made me feel throughout my entire rehab and afterwards just made me so happy, and that's how I want to make people feel.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to all of our audience members, especially our patients, for sharing their stories with us. And of course, to our amazing panel, Drs. Avalon and Keller, and physical therapist Seth. Thank you all for being here today. We've had a good conversation about sports medicine, sports-related injuries, and now we want to take some questions from our studio audience. All right, Dr. Keller, I'm going to start with you. What advice do you have for athletes to improve their performance as it relates to nutrition and training?
I think when you bring up a topic like nutrition, it's a very, very vast topic, and when you go into these nutritional supplement stores, you may kind of be overwhelmed a little bit. And I think athletes are always kind of looking at that and saying, should I be doing one of these things to become an elite athlete? And the answer truly is no. The answer that a lot of them are looking for is just maintaining a well-balanced diet on a daily basis. This is something that would be, consisting of lean meats and plenty of vegetables, fruits, whole grains, those kind of things that are general areas of nutrition that we all learn in health and issues, just paying attention to our diet.
So really just understanding that a balanced diet is what we're all looking for is just as important to an elite athlete. All right, the next question, Dr. Avalon, is for you. This one is pretty specific. How do ACL injuries typically occur, and is it true that girls are more susceptible than boys?
Well, it is very true that girls in same sport are more susceptible than boys. And if you look at soccer and basketball, for instance, sometimes between 3 and 9 times more likely in a girl basketball player than a male basketball player.
That's a really high number.
Tremendous. And so we think there are a lot of variables that go into that, but what we're trying to accomplish is injury prevention programs. Most of these injuries are non-contact. People are just trying to cut, stop, turn, nobody's around them. So more than half, more than 60% in fact, are non-contact injuries.
And can you get them back to playing that sport? Is an ACL career ending anymore?
Not anymore, not anymore. And you know, we think that we've made a lot of great progress in how to correctly rehabilitate and reconstruct that person's knee. You know, it's still going to take some more, I think, in the future to be able to understand all the variables to get a person back on the field. But we're doing a very good job at this point with what we know and getting people back to playing the sports that they love.
Well, it's a lot of hope for people. Dr. Keller, I want to ask you a question that someone raised about concussions. And we didn't really touch on concussions today, but is a concussion a sports-related injury? And if so, how do you assess that someone has one? And then how do you know when they can return to playing their sport?
A concussion is very much so a sports-related injury. Concussions are one of the most common things I see in my office. Being a concussion expert, I kind of am a little bit of the front lines of when I see a concussion in an athlete. Typically what happens is an athlete would sustain a head injury and then just have some symptoms afterwards where they don't quite feel right. Sometimes it's headache, dizziness, blurred vision, sometimes just not really making sense of what's happening in the game. One of the best things that we can do is recognize these injuries. I do a lot of speaking to a lot of coaches, parents, and as well as some of our medical professionals, and I just teach them to recognize when an athlete might be injured. And I say might because it's really hard to tell. There's no one test that completely diagnoses a concussion. There's no X-ray, CAT scan, MRI, blood test that says, yeah, you have a concussion. So what I really do is try to put the whole scenario together to say, do I think there was an injury and are they really suffering from a concussion? That can be done from a pediatrician's office, a family medicine office, an emergency room, or an urgent care, a lot of times if you're suspecting a concussion injury. But really getting the athlete to someone who has training like myself or Dr. Avalon that recognizes concussions, and we can say, let's formulate a plan to try to get you back on the field. So the reason we make a big deal and the reason you hear about things in professional sports with concussions is that we want to prevent something called second impact syndrome. Second impact is when someone gets a second concussion on top of the first one. That's really the main reason all of these things exist, is we have to prevent that. So one of the things I do in my office is we create an individualized program for each athlete and say, this is how we're going to progress you back, this is how we're going to help you feel better, and this is how we're going to make sure it's safe for you to get back on the field.
And like Seth mentioned earlier, not pushing through the pain, not saying suck it up. If you got hit, you fell, you hit your head, get checked out because help is out there. Thank you all so much for joining us. This has been an incredible conversation. I feel like we could go for a whole nother episode on sports medicine and sports-related injuries. There's so much to learn. We appreciate you being here.
Our pleasure.
Thank you.
And thank you so much to our studio audience and all of our patients for being here tonight. For more information on sports medicine at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.